Hi everyone. There are two main types of childbirth: vaginal delivery and cesarean section, that is CS or C-section. Each has its own processes, benefits, risks and recovery times. Vaginal delivery. Process 1. Labor onset. Labor begins naturally with regular contractions, or it may be induced if necessary. The cell dilates, opens, and effaces, thins out to allow the baby to pass through. 2. Stages of labor. First stage, early labor, active labor, and transition phase. The cell dilates to 10 centimeters. Second stage, the pushing stage, where the baby moves through the birth canal and is born. Third stage, delivery of the placenta. 3. Assistance during delivery. Pain relief options includes epidural, breathing techniques, or natural pain management methods. Assisted delivery, if needed, forceps or a vacuum might be used to help guide the baby out. Benefits: shorter recovery time. Women typically recover faster compared to a C-section. Lower risk of complications. Generally, there is less risk of infection, blood clots, and other complications. Immediate skin-to-skin contact. This promotes bonding and helps regulate the baby's temperature and heartbeat. Risk: tearing or episiotomy. There can be tearing or tissues or a surgical cut, episiotomy, to aid delivery. Prolonged labor. Labor can be long and exhausting and may sometimes result in emergency C-section. Pelvic floor injury. Vaginal birth can sometimes lead to pelvic floor disorders such as incontinence. Cesarean section, C-section or CS. Process 1. Preparation. A C-section may be planned by choice, that is, elective, or performed as an emergency procedure. If complications arise during labor or before due time or due date, you will be given anesthesia, typically a spinal block or epidural, so you are awake but numb from the waist down. 2. Surgery. The surgeon makes an incision in the abdomen and uterus. The baby is delivered through the incision, followed by the placenta. The incisions are then closed with stitches or staples. 3. Types of C-sections. Planned. Scheduled in advance, often due to medical reasons such as breech position, placenta previa, or maternal health issues. Emergency. Performed when complications during labor make delivery unsafe for mother or baby. Benefits: controlled environment. A planned C-section can be scheduled and is done under controlled conditions. Avoids labor complication. This can prevent potential complications that might arise during a difficult vaginal delivery. Useful for medical reasons. Necessary in situations where vaginal delivery poses a risk, such as with certain maternal or fetal conditions. Risk: longer recovery time. Recovery is generally longer and more painful than vaginal delivery, often taking 6 to 8 weeks. Surgical risks include risks associated with major surgery such as infections, blood clots, and anesthesia reactions. Breathing problems for the baby. Babies born via C-section, especially before 39 weeks, may have a higher risk of respiratory issues. Potential for future C-sections. After one C-section, there may be a higher likelihood of needing C-sections in future pregnancies. Though birth after C-section is possible for women. Recovery. V-delivery recovery. Typically quicker, with women often being able to walk around within a few hours after delivery. Some discomfort from tearing or stomach stitches, as well as bleeding for several weeks. Pelvic floor exercises can help strengthen muscles and aid recovery. C-section recovery requires a longer hospital stay, 3 to 4 days, and a recovery period of about 6 to 8 weeks. Pain and discomfort at the incision site, and you will need to avoid lifting heavy objects and strenuous activities. It is important to monitor the incision for signs of infection and take care with movements to avoid straining the abdominal muscles. Choosing the best option. Vaginal belt, often recommended for most healthy pregnancies, but it is important to be prepared for the possibility of an emergency C-section. C-section may be necessary for certain medical conditions, and in some cases, women may choose it for personal or medical reasons. So it is very essential to discuss your birth plan with your healthcare provider, who can help guide you based on your health, pregnancy, and personal preferences. Let's end it here today. Take care of yourself, take care of your pregnancy, make the best decision for your delivery procedure. See you in my next video. Bye-bye.